My name is Michael Roberts. I'm the current Chief of Staff at East Alabama Medical Center. I'm from Opelika originally. I've been here at East Alabama since 2008, and I'm a hospitalist here. When we talk about social distancing, I think how that's commonly portrayed is trying to keep a distance from other people, but basically going about your daily life. And I think when we talk about social distancing as medical professionals, we're talking about making a concentrated effort to limit your points of contact. When we talk about social distancing as it pertains to your household, as it pertains to your family, we're talking about your primary contact being those within your immediate household, your spouse and your children. These are your points of contact, and every point of contact outside of that is putting you and your family at risk. And so when we talk about social distancing, we're talking about really breaking it down, really limiting your risk, really limiting the risk of those who are vulnerable in our communities. And so that's what we mean when we talk about social distancing. So there are many tools out there to try to estimate the impact of COVID-19 on an individual community. There is a group of epidemiologists at Penn who put together a model where it allows inputs for your specific region's population, the market share of your hospital, the number of patients that you are currently caring for in the hospital, the onset of the illness in your community, meaning the first time that you admitted a patient to the hospital with COVID-19. And using those variables, I plugged in some of the numbers to try to give us an idea of what COVID-19 might look like in our community. And some of the numbers are alarming, quite honestly, and it's not meant to be scary, but it is meant to show us how bad it could be if we do a very, very bad job at social distancing, if we do a very bad job at limiting our contact with other people. We could very quickly overwhelm our medical system here. At 0% social distancing. So when I say 0% social distancing, if we just go about our daily lives and we keep going to ball games and we keep going to church and we keep hugging our friends when we see them at the grocery store, then by this model from Penn Medicine, we could have close to 2,000 inpatients in the hospital, which far exceeds our capacity at East Alabama Medical Center. We could have almost 700 patients in the ICU, almost 500 patients on life support. These aren't things that we're capable of doing. These numbers far exceed our capacity to care for those patients at East Alabama Medical Center. As our percentage of social distancing improves, as we go to 25 and then 50% and then 75%, we begin to get to numbers that are more feasible. The other thing that increasing social distancing does is it delays our peak for that level of illness, for the patients who are hospitalized, for the patients who are requiring critical care, for the patients who are on life support. So that at 50% social distancing, the peak date for hospitalizations and patients requiring critical care is estimated to be May the 15th, so the middle of May. At 75% social distancing, we can push that out into June. And while that sounds like a long time, the important part there is that as we push that time out, it gives us more time to allocate resources. It gives us more time to obtain additional ventilators, to take care of more patients who require life support, so that we can do what we already know how to do, which is take care of really sick people. The problem with this illness is that when it comes into a community, the onset is very rapid and it overwhelms, and it depletes the resources very quickly, and that's what we're trying to prevent from happening. One important part of this model is that if we could achieve 100% social distancing, if every person in Lee County and Chambers County stayed at home except for essential travel, who kept away from extra contacts outside their home, including family. I think that it's important that we are aware that we are capable of spreading this virus to other members of our own family, your grandparents, who are at much higher risk of developing severe illness from this disease. The last thing any of us wants to do is cause an infection in them. And so social distancing even includes members of your own family. But if we can achieve 100% social distancing, and we can all do a really good job, then we may already be approaching our peak. We might be able to prevent new cases and keep those people from getting sick and keep them from getting out of the hospital. And in turn, that allows us to all return to the lives we're used to living much, much sooner. So I can tell you a little bit about where we are now at East Alabama Medical Center. Generally speaking, we have about 30 critical care beds. We have 20 beds in our med-surg ICU, and we have another 10 in our cardiovascular ICU. And we're a busy hospital, and we run near capacity at those beds a lot of the time. Right now, both of those units are completely full of COVID-19 patients, and we are reaching our capacity in terms of ventilators in order to provide people with oxygenation. We are reaching our capacity for providers, for physicians and nursing staff. People are working extra shifts. People are putting in long days, and our system is highly stressed. And if we continue to meet, and if we continue to ignore the recommendations to shelter in place, then we may put ourselves in a position where we're not able to provide that care for some of our sickest patients. And that's a position that none of us wants to be in. The bottom line is we have no time to spare. We cannot wait another day. Every day that we delay 100% social distancing, lives are being lost. We are compromising our ability to return to the life that we all consider to be normal. We are, by allowing this virus to continue to decimate our community, we are condemning ourselves to more time away from the things that we enjoy, away from the people that we love. If we want to put an end to this, now is the time to act. I certainly understand the concern of local businesses with revenues lost, with people out of work, and none of us wants that. That's not good for anybody in our community. However, if this virus continues to spread, if we continue to do a poor job at social distancing, we are looking at a much longer period of time where this virus affects us to such an extreme degree. The more quickly we can shut down the transmission of this virus, the more quickly we can effectively distance ourselves from one another, the quicker we can get on top of this as a medical facility and as a community, and we can return to a more normal life. As I mentioned at the beginning, I am from Opelika. I live in this community. I work in this community, and what we have seen in this hospital, the outpouring of support, the people coming to pray for our providers, the people bringing food to our nursing staff, just on every level, the support that we've received as a medical community is second to none. And I can't thank you enough for what you have done for our staff and the way that you continue to support them. It's one of the things that I truly love about this community, is the way that people come together. I appreciate you giving me the opportunity to speak to you today. I hope that you know that this is coming from the heart. I have no agenda other than seeing us return to the community that I know that we can be. I want to see our patients get better and recover from this virus. I want to see families reunited. I want to see people at ball games. I want to see all of us return to church. I want everybody to return to the lives that they're used to living. And in order to do that, it's going to take us coming together as a community one more time and doing the right thing. Thank you.